everybody. My name is Peter Werwine. I'm Senior Editor of Managed Healthcare Executive. And this morning, I'm speaking to Lou Ellen Horwitz, who is CEO of the Urgent Care Association. And she's been in the job for 3 months, but that's a bit misleading because actually she's been on the board of directors for 4 years and was CEO of the association from 2006 to 2012. So she knows this territory well. So thanks for speaking with me this morning.
Great to be here. Thanks for having me.
So I guess, most of the people watching this and listening to it are well aware that urgent care centers, the number of them has increased, and it's become an increasing important part of the healthcare delivery system in this country. And they have, in some sense, in many cases, been kind of a way of people getting care in emergency situations or acute situations where instead of going to an emergency department or perhaps a doctor's office or waiting to go to a doctor's office. But along comes COVID-19, starting in mid-March, of course. So I guess, in many parts of the delivery system, COVID-19 has meant a slacking off of services, except for in hotspot areas. So I'm wondering what's happened to the use of urgent care during the pandemic. Did you see a surge, or did things go quiet?
It was a little bit of a roller coaster, to be honest. At the very, very beginning, when there was no testing, and even early on when there was a little bit of testing available, it was a ghost town in urgent care for about 2 or 3 weeks, really. Mostly because everyone was told to stay home in general, and also because people would come to the centers and we had no ability to service them because there was nothing we could do about it. And so we saw volumes drop off nationally by 60%. It got very, very quiet. And then as the testing kits became available, and urgent cares we had some struggles really in getting supplies for probably, at least a month. And so patients started coming and coming and coming. And in many ways, in some places they had to turn them away because they had run out of personal protective equipment, or they were out of test kits or whatever. And so it was a rocky period there as we were re-ramping up, because one of the things that has really become very clear to us is how marginalized is not the right word, but urgent cares were not, the whole body of urgent care, and there's almost 10,000 of them in the country, weren't seen as a place that patients would go to get tested. And so, even in my own area, I'm watching these tents get set up in parking lots, and I'm thinking, we're right here. We don't require an appointment. We've been walking since the day that we were born. How did this get missed? And so I think that was one of the tragedies as we saw it, is that we're literally right here. We're used to this kind of up and down volume. We're used to surges. We know how to handle this. We have technology in place to, triage before you come in. So, that ultimately people started figuring that out on the patient side, not necessarily on the, regulatory legislative side of the folks who, were saying go here or go there. But patients started to realize, oh, I can still go there. And so so we are covered up right now. The centers, everybody almost that I know is not overwhelmed, but they're at peak. They're extremely busy. And so the only challenges we have right now is really some fluctuation in supply availability. And so we have, obviously relationships with big companies that provide all of those things. And we try to get a little heads up of gloves are we're starting to run out of gloves. Let's start, let's order up on that. And I think where the big concern is now is really twofold. One is the flu COVID combination season. And how that's going to get managed. And then when the vaccine is ready, how is that going to get distributed? Can we have a role in that? And so the association has been spending most of our time saying, hi, remember us? Here we are, and we know them all, and we've got their addresses. And so we've been able to stand up some testing databases and those kind of things, and are starting to get those out in the public eye. We've had some great vendor partners help us with that. And I think the awareness of urgent care's role, even if it wasn't set up to be a role, we already had such good relationships with patients in the community. They're coming. And so the patients figured it out. And so we're finally starting to get that clicking at a more national level of, oh, we need to not put them on the third tier of the list for supplies, because that's where the patients are going. And so I think it also will be cost effective nationally, because you don't need to stand up a tent. As I said, we're here already, so you don't need to go through all of that. And I think that's everybody's kind of figuring that out now. Where it gets, the struggles that we're having nationally, the same ones that everybody's having nationally, is the delay in test results. And there are reimbursements around. If you could do a rapid test, and if you got a positive result, you could then get it validated by an external lab. That would be the magic way to be sure about everything. But it's not. The payer community, I think, is really still trying to catch up on what should be happening and what yeah, I'll just say that.
Right. So how is it that urgent care was sort of forgotten about, that line of delivery was forgotten about in the early part of the pandemic? Were you sort of, did other parts of the system sort of grab hold of it, or what happened?
I think that we are urgent. I don't want to say that we're outside of the system a little bit, but we are. The majority of urgent cares are independently owned and operated. And though there's 10,000 of them, probably half of those are one center owned by one person. And so the only, collective voice they have is somebody like the Urgent Care Association. And this may or may not surprise you, it's relatively hard to penetrate the national scene of healthcare. And so, we've only been around as an association 17 years, I think. And that sounds like a long time, but it's not. And so I think partly, we have some responsibility for that, of not being noisier beforehand. But a lot of healthcare is also very local. And so I think it's a combination of factors. We also have not spent a lot of time and energy wanting to be heard on the national stage. That's not, wasn't what our members really needed. And so that's not really where our efforts have been focused. We, aren't spending hundreds of thousands of dollars every single year on a lobbyist to go and do those kinds of things. And so, I think it was, in a way, it caught us a little bit by surprise, because we feel so well known to the patient community. But from a regulatory standpoint, we are generally lumped in with primary care regular doctors' offices. And so, and in many ways, that's good, because in a lot of ways we are just like that. We have typically a lab and an x-ray, which most of them don't have, and those are regulated at the state level. So do we need to throw another separate license on? Generally not. And we don't get into the emergency scope of care. And so we don't really fall over there either. So I think it's, the place that we occupy in the continuum of health is really, really important, but kind of in the middle, if you look at it from 100 years worth of traditional medicine. And I think it's also, there's not a, go ahead.
Plus, I think you're also, in some sense, in the same market or space, as we say, as the in-store retail clinics, the minute clinics, and so on. and perhaps some jockeying for position with Walgreens, Walmart, and CVS as well.
Yeah, I think it's a common misconception that we're in the same space. But sorry, because
I guess I got this one wrong.
see how common it is, but because their scope of service is so narrow compared to ours, so they most of what they can take care of in those retail clinics, yes, it's walk-in, yes, all of those things. And they typically can treat it because of their physical setup, and within that clinic, or at least the way it's traditionally been, and generally because of the way that they staff it, and they don't have a lab and they don't have x-ray and those kinds of things, what they're able to take care of is really limited. So we have a great relationship for the most part with them, in the community, because we take, once it gets past their scope of service, they send them to us. And so it's been a really good relationship. So I don't mean this to sound pejorative at all. But we, again, because there's probably 5 players in that space, because they're corporately, it's CVS. And so that's a really easy phone call for whoever's in charge of Operation Warp Speed to pick up the phone and call that person, and all of a sudden have all 2,000 of CVS centers. And to reach the urgent care or companies, all they have to do is call me, but I don't own them. And so it is a little bit of a different mix. I can see why the choice was made that it was